Welcome to Integrated Spine Pain and Wellness, Pain Perspective. I am Nikki Goyle, and I am here with my husband, Dr. Ashu Goyle. He is our pain and regenerative medicine physician at ISPW. Today's topic, we are going to be discussing herniated discs. Anybody who has had a herniated disc knows that it can be very painful. And so we're going to get some information from Dr. Goyle on exactly what this issue is and how you can help to heal yourself. So, Dr. Goyle, can you explain to anybody watching what is a herniated disc?
Absolutely. So this is one of the most common things I see in my practice are herniated disc, or the layman's term is slip disc.
Oh, okay.
So in our spine, we have bones in between each, and those are called vertebrae. In between each vertebrae, we have discs. Those discs are cushions. They're cartilage cushions that support the spine and allow for motion and mobility. They have some give and take. And when there's an injury or the stresses on each disc becomes optimal for injury, then the fibers on the outside of the disc can split open and the disc material can leak out into the spinal canal.
Okay.
And when that happens, it can hit the nerves.
Okay.
So a common term is sciatica. So that's pain that begins in the back and radiates down the leg.
Okay.
And this can happen anywhere along the entire spine, in the neck all the way down to the low back. So when this happens, it can be very painful, very debilitating. And so I'll see patients sometimes acutely who have this, and we can try immediately to reduce inflammation. Usually they'll need something powerful like a steroid pack or some kind of cortisone, and then muscle relaxers just to have the body's response to this injury abated a bit, so they're not in this constant state of stress and tension and pain. Physical therapy is very important to help alleviate this, because it becomes a biomechanical issue. Your body's trying to compensate, take pressure off the disc, and the process, it can create more dysfunction.
What are some causes of a herniated disc?
So there can be several causes. Sometimes it's lifting weights, sometimes it's running, sometimes people are doing household activities, lifting of a heavy flower pot, for example.
Okay.
Working on their car, doing dishes even.
Oh, really?
So, yeah.
Dishes. Okay.
So, I mean, and that can happen acutely, but typically when we see a herniated disc, there's been a defect in the disc that's occurring over time.
Okay.
And then it gets to this critical point where the fibers on the outside of the disc split open, the disc material leaks out and hits the nerve and causes pain.
And what causes the defect?
Body mechanics.
Oh,
core strength, lack of core strength.
Okay.
Yeah. Posture. How we, for example, if you carry your purse or you carry a satchel on one side, it's going to change your body mechanics, right? So you're going to load one side versus the other. And that disc over time, those discs on one side can become damaged.
Now, we've talked in other segments about DME, durable medical equipment, which is basically a back brace. So would a back brace help to support you when you're doing some of these activities to prevent further injury?
Yeah, that's definitely an option, depending on what kind of activities you're doing. And, a back brace can give you support, stabilize the segments, and ideally take pressure off the discs and the nerves. You kind of want to limit your use of those, though, because you don't want to weaken your own core musculature. But if you have an acute injury, that may be a good time to use a back brace. For people who have like chronic injuries, or like spinal stenosis is another cause of sciatica, which we'll talk about in a different segment. But for people who have a chronic recurrence of that, a back brace may be a good option for them when they're doing different activities. So.
And what are some symptoms that patients want to look out for to determine if they need to come and see you and if they could possibly have a herniated disc?
So typically patients, when they have this kind of an injury, they'll try over-the-counter medications. They'll usually see their primary care specialist, get muscle relaxers, maybe some basic x-rays. But if they're not responding to that and then physical therapy over the course of 4 to 6 weeks, then it's a good time to come see someone like me, a pain specialist or spine specialist, to take a look and see if there's more interventions that are needed, or more aggressive treatment, or even further imaging, such as an MRI study.
Now, when they come in for an exam, what are you looking for to determine if they have, in fact, a herniated disc?
Well, the big thing I look for when patients come in with back and leg pain or sciatic pain is their neurological function.
Okay.
So I'm trying to determine if this is a serious enough issue to send the patient to the emergency room or talk to a surgeon.
Oh, wow.
So, for example, if you have a severely herniated disc that compresses a nerve, you can lose motor function, which means that your foot won't work. We call that foot drop. That's just one
Okay.
example.
Okay.
Or you can have numbness. So I'll do a neuro examination, and it's pretty simple. Have patient walk on their heels, walk on their
Okay.
toes, and if they have profound weakness, then that's concerning. That would
Okay.
warrant more rapid treatment, more rapid workup with an MRI study, and possible surgical consultation. So those are the things I look for. Those are the big
Okay.
red flag things.
Okay.
Loss of bowel or bladder control can be a
Okay.
sign that the disc is herniated and compressing the spinal cord, and all these things can happen. So these are the
Okay.
things I look for. But once I rule out all the catastrophic stuff, then it's just based on what I'm actually finding and what I think the source is.
And then what does treatment look like for a herniated disc?
Well, time is the best thing.
Okay.
But if there are neurological changes, like we talked about, depending on the extent of those, if it's more serious, then they may require surgical intervention. If the deficits are minor, then we may proceed with doing what's called an epidural steroid injection, which is an injection of cortisone around the disc nerve interface to reduce inflammation there,
Okay.
just to calm down the pain. Ideally, what we do is we control the pain, and then the patient gets referred to physical therapy, and they'll do physical therapy to really promote health and healing and rehabilitation.
Yeah, wonderful. Now, is there anything that people can do at home to help prevent a herniated disc or prevent injury in that sense?
Sure. So body mechanics is probably the most
Okay.
important thing, really working on core strength. I'm a big proponent of physical therapy
Yeah.
and believe in the benefit of really having someone who, these doctors, doctorates
Yeah.
of physical therapy, really working with you to strengthen your core, give you exercises, and teach you how to use your body
Yeah.
optimally. It's something we don't learn
Right.
in our physical education
Yeah.
curriculum in elementary school and junior high and high school. And I think that really learning your body mechanics is important. So learn how to lift, learn how to twist, learn how to carry, all that stuff makes a difference. And that's how you can prevent these types of injuries.
So if a patient is interested in helping, if maybe they have some minor symptoms and they want to prevent further injury, is this something that they can come in and talk to you about and have you refer them out to physical therapy?
Absolutely. Yeah,
Okay.
actually do see a lot of patients who are like, hey, I have exacerbations a couple of times a year. Not having a bad one now, but what can I do to prevent this? Can we figure it out what's going on? And so I'm happy to do the workup, really find out what the underlying cause is pathologically,
Right.
and what the anatomy is. And then based on that, we can kind of tailor their program towards prevention.
Wonderful. Thank you for watching, and stay tuned for further topics with myself and Dr. Goyle. Thank you.
Great, thank you.